Good morning, good morning, good morning, and welcome once again to your Saturday online program. My name is Regina Williams. I'm a New York-based family nurse practitioner, and this is your Saturday online program. Okay, we welcome all our viewers from around the world. Thank you again for taking time out to be with us this morning. Please make your comments in the comment box, send us your questions, and let us know from which part of the world you are calling from so we can tailor our programs to meet specific needs, okay? I'd like to confirm that my contributors are online and everybody can hear me fine. And please indicate that our audio is good and that everybody's hearing me. Cameraman, please put the phone closer. Okay. Today we're talking about nursing, specialization, and performance. We have some gifted and talented nurses with us. We have Ms. Hannat Panford, who's going to be talking about nursing leadership. We have Ms. Maria Filipova, who will be joining us on screen. And we have Ms. Imabong Akakwan, who will be joining us from Nigeria. It is a pleasure to have all of you with us. Please, can I have our contributors and viewers all mute their phones? Use your headphones so that your phones will be muted, and then that will help us save our audio. Okay? Thank you once again, and I welcome everybody watching us. All right. This program is sponsored by African Views, and it's supported by Campaign for Nurse Excellence in Nigeria. It's also supported by Regina Foundation, and once again, it's a pleasure to have you. I'm going to go ahead and start with Ms. Hannat Panford. Ms. Hannat, it's a pleasure to have you with us. Can you say hello to our viewers? Let's see that everybody's hearing you okay.
Good afternoon. Thank you for having me, Regina. Good afternoon, everybody. Thank you for tuning in.
It's a pleasure to have you with us, and I hope our viewers can hear you. Indicate, please, cameraman. Let me know that everything is okay. All right. I'm very excited to have you with us, Hannat. We had a very interesting discussion about nursing socialization and performance, and I could not miss or pass by the opportunity to share that conversation with the rest of our viewers. Now, when you talk about socialization, it usually means how a nurse is able to interact professionally with her colleagues, right?
Yeah.
But we would want to stretch out socialization to encompass to cover the student nurse, the practicing nurse, and the nurses across different generations. Basically, we're trying to have a discussion on a healthy work environment where nurses can practice safely and deliver safe care for positive patient outcomes, okay? So, we're going to explore several factors of socialization. Usually, it is based on how to encourage a nurse to form a professional identity, right? Okay. So, in talking about relationship between professionals on the unit, let's jump right into the one major complaint that most of the nurses talk about, and that is nurses eating their young. Let's start with bullying. Ms. Hannah, can you give us, first of all, a picture of your journey, your professional qualifications, and then we can talk about bullying amongst nurses.
Okay. Thank you for having me. Professional experience. I started as an LPN in 2007. Got it out of nursing school. I worked with the elderly population for the most part, and I worked with that for about 7 years.
Yes.
Working in the nursing home, working in the home care. And then I got my RN in 2014, and I got my master's most recently at the end of 2018. I've worked in primarily outpatient facilities. I've also worked in inpatient, med-surg, procedural areas, as well as doing moderate sedation. Across a wide variety of nursing persona.
Yes.
In my experience, I've been able to really tailor how I go about my job every day, working with a variety of individuals.
Yes, and recently, I know that you're on your way to being a nurse leader, and we were talking about the characteristics that you would consider or you would arm yourself with in being a nurse leader. Can we explore some of those characteristics that?
Oh, yes, definitely. Yes. During my curriculum, my master's degree, we had to do a lot of papers on different types of leader styles. I definitely identify with the transformational leadership style. I like to incorporate the staff's opinions, their suggestions. I like them to feel a part of the decision-making process. And I feel like that's very important so that nurses feel like their voices are heard. One of the things that I have seen and I have experienced is a nurse not being heard or being felt like they have the support with upper management that can really hinder their progress on a unit, in a department. So I really feel like it's very, very important to include your staff nurses' opinions, their attitudes, their goals when it comes to decision-making policies in the department.
Okay, thank you, Hannat. I'd like to ask our cameraman if our audio is good. Our viewers are complaining about the audio. Is good? No. Okay, we're all good. What is it with these bikes? All right. Thank you, Miss Hannah. We're having a little problem because there's a bike marathon going on, so it's messing up our audio. Okay, so back to, oh my goodness. Okay, back to a conversation. Now, a transformational leader includes the staff nurses and makes them feel like they are being heard. But is it all the staff nurses that are included? Because on a unit, sometimes, some people will always feel, some members of your staff unit will always feel that they are left out, not included, or not supported. How would you be able to pick out that nurse or those nurses that feel that they don't have enough support from their nurse leader or from their nurse manager?
It would really take a very attentive nurse leader to pinpoint those individuals. So if we were to have, not necessarily a suggestion box, but if we were to have a staff meeting and I noticed that, nurse B or nurse C, they're not really contributing as much, I would later talk to them on the side saying, hey, didn't see that you had much to contribute. Is there anything, that you would like to discuss in private? Because they might not be comfortable bringing up their issues in front of an audience. So it would take the discernment of a nurse leader, as well as the attentiveness to really understand, what their staff is going through. You don't have to break you wouldn't necessarily break the personal boundaries of being their nurse leader, but you have to be attentive and understand that, okay, they might be having a problem, and it could be that they're being bullied and they don't want to say anything. So it would take the attentiveness and the discernment of a nurse leader to really be able to have that lines of communication open with staff.
Okay, thank you. Now, you touched on bullying. All right, it's usually the very quiet nurse who does not contribute a lot when it's time for the staff meeting, who practices by herself, who does not really interact. That is usually the nurse that is having a problem. And you talked about reaching out to her and having a conversation with her. Let us talk about bullying and creating a non-toxic work environment. Why does one nurse bully the other? What leads to that situation? Right? Can you throw more light on that?
Well, that question is very biased, I would say, because you can never really pinpoint why a nurse bullies.
Yeah.
Some nurses I've seen, some nurses I've come across, they're very seasoned, they're set in their ways. When they see, other nurses coming to either challenge the way they do something or just put out another suggestion, the way that they may respond to that, could be maybe a little bit aggressive. I have come across a nurse that, she was known on the unit as the bull.
Yeah.
But she wasn't necessarily a bully. She was just very vocal in what she would or would not do.
Oh, okay. I'm sorry to jump in here. I would like, before we go too far, let us discuss what situations or what interactions might be labeled as bullying. All right?
Ooh,
so let's talk about that so that we can really throw more light on that issue because it's becoming a serious problem. We find a lot of nurses quitting the profession. They say they like nursing, but the politics of the environment they cannot deal with. So let's talk about a few examples of bullying and take it from there. Okay.
So bullying can come in many different forms. It can be covert, it can be overt. Covert would be something that can be a little bit more passive aggressive, where you are trying to take your lunch break, but the nurse knows you want to take your lunch break and then she's nowhere to be found. You can't give report, or the charge nurse doesn't want to take report. That would be like more passive aggressive and covert. Overt bullying is straight out, you can't hide it.
Yes.
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 It's something that you can't hide, something that the nurse manager might have to get involved with. If it's something that's displayed on the unit that other patients, nurses, their staff can see. Yes. And there's really no rhyme or reason as to which nurse does the covert style or which nurse does the overt style.
Yeah.
It's a matter of how it's handled once the nurse leader is aware of the problem.
A matter of how it's handled. Okay, let me give more examples of the overt type of bullying, where a nurse is particularly rude to several other nurses in terms of yelling, threatening body language, and consistently picking on a particular nurse. Another example is gossip, like dubbing one nurse like she don't know what she's doing, she's dumb, and this type of comments on the unit. Environment like that creates nothing but a toxic situation where there is avoidance behavior, where there is no cooperation between the nurse and the nurses, and this does not make for smooth practice. And at the end of this, the patients feel it, and the patients don't feel comfortable on the unit. As a nurse manager, could you talk to me about how you would handle situations of bullying? We're having a lot of environmental noise interference. Could you talk to me about how you would handle bullying on your unit as a nurse manager? If somebody comes to report a bully to you.
I would like to backtrack to a situation I was in where I witnessed bullying as a staff nurse between two other staff nurses. It was a weekend, so the nurse manager wasn't there, so she couldn't get involved. But one nurse she's charge nurse, she wasn't charge nurse that day, but she got upset or offended when one of the other nurses kind of jokingly said that she doesn't nurse. So later on in the
we didn't get that. We missed that. When one of the staff nurses jokingly said
that when the other nurse, so let's say the nurse who's usually charged, Stephanie's usually charged, but that weekend she wasn't charged.
Okay.
So Cindy jokingly said that Stephanie is not the best charge nurse.
Oh dear.
And Stephanie was offended by it. So later on in the day, Stephanie started gossiping about Cindy. And I don't know who she said it to, but it got to me. So I took it myself because I saw how much it affected Cindy. Cindy actually started crying. She started crying. She was very frustrated. And I took it upon myself because I saw that. And the nurse leader in me just kicked into action. And I went to go talk to Stephanie. And I asked her, like, why are you saying these things about Cindy? And it turned out that Stephanie was hurt about what Cindy said. So I asked them, I was like, well, can you two have a discussion amongst each other? Because we all have to work together, and I don't think it's fair for the way that Cindy is being treated, not excusing what Cindy said about you, Stephanie. And they did talk, and Stephanie did apologize to Cindy. And then later on in the day, I got Cindy something slipped up her spirits because she was very, very, very distraught about what Stephanie was saying about her.
I can imagine.
Yeah, so as a nurse manager, even though I wasn't a nurse manager at the time, but had they been my staff, I probably would have kicked the same way as in going to talk to Stephanie and finding out like, hey, what's the problem? Because Cindy didn't know that Stephanie was offended by what she said. Cindy said it in a joking way, but Cindy said it because that was her truth. You know, she felt like when Stephanie is charged, she doesn't do anything for her. So I let Cindy know, hey, sometimes what you say can be offensive to other people. So you should, be very cautious about what you're saying. So
Yes.
I think it's a matter of perception. It's a matter of understanding and having some idea of what you say can hurt somebody, and somebody can be sensitive. So it's best to just not say anything to anybody at work.
Yes, joking about professional competence might not be the best joke to throw around at work. And thankfully you were there to mitigate that situation. Otherwise, it would have degenerated into, like I mentioned, a toxic environment. But the thing that happens is that on so many occasions, we do not have nurse managers who are able to mitigate that situation.
Correct.
Sad situations like I have witnessed would be faction formation on the unit. So you have this faction against that faction against that faction, and a situation where like people of nurses of a particular culture band together and help each other to the exclusion of nurses of a culture that is not their own. It's not a very healthy work environment. Have you noticed something like that? Like the Russian nurses help each other, the Asian nurses help each other, and things like that. And then if you do not belong to a clique, you are kind of left out, and then you do not feel welcome, you do not feel comfortable on that unit. And sadder still is a nurse manager that runs the unit like she's some kind of mafia boss. We were talking about a transformational leader. We were talking about, there are different types of leadership styles, and yours is a transformational leadership style. In order to repair the work environment, in a unit where factions have been formed to the exclusion of some, what would you as a transformational leader do to rectify that situation?
So luckily, I was fortunate enough to work on a unit where there was a lot of diversity. I didn't see, much clicking up among cultural nurses or anything like that. It was very diverse. A majority was Caucasian, but I never felt that sense of cultural clicking up. So I can't really speak on that point. But as far as trying to foster, an environment where there are no cliques.
Yes.
What my manager did, which I really felt was very, very helpful, was very frequently they would, hey guys, we're going to go out for happy hour after work. We're going to go for the holiday party. We're going to go for, seasonal outings that gave staff members an opportunity to connect with each other outside of work. And whether you went to them all the time or not, the opportunity was there to connect outside of work. And I feel like I've never worked anywhere where that was something that was very prominent in the workforce, and I feel like that really helped. There was one nurse who had anxiety attacks, and everybody was very, very judging with her. But after going out with her, they were instead of judgmentally delicate of her, they were very compassionate towards her because she was able to share her story with them outside of the workplace, and she felt a lot comfortable. In that instance, yes. So I would definitely continue that once, in my position now, try to foster that kind of familial relationship among the nurses where they would feel comfortable to talk to each other about personal things outside of work.
All right. Okay, can I request for us to connect Ms. Imabong Akwakwad from Nigeria? Because we're going to talk about performance. And in talking about performance, we're going to talk about nurse qualification. Who is checking nurse qualifications? Who is making sure that the nurse is, could you call Nigeria for me? Who is making sure that the nurse is clicking the milestones and progressing through her career as she's supposed to? Because there have been situations where certain nurses are not given the opportunities to advance in their training or in their specialization. We hear you. Thank you. Welcome. We welcome you to this discussion, Ms. Akwakwam. We welcome you to this discussion. We are going to ask you to talk about performance and opportunities for training for nurses in Nigeria. I have been speaking with Miss Hannat Panford, and she has taken us through the role of a transformational leader in creating a non-toxic work environment for nurses. So I welcome you from Nigeria. Can you talk to us about performance and specialization in Nigeria a little bit? Can we hear her? Go ahead, Miss Imabong, please. You're welcome to the program.
Hello?
Yes, go ahead. We can hear you.
Oh, thank you very much. We really haven't always
Can our viewers hear her?
Can you hear me?
Hardly. We can hardly hear you.
Can you hear me?
No, we can hardly hear you.
I'm actually on the road driving. I'm driving. I'm looking at CPS because I was going to CPS. So I'm on the road. And then it's easy for me. And when I at the contact people audible.
Are viewers hearing her? I can hardly hear
Can
her.
you hear me?
No, I'm sorry, we cannot hear you. We can hardly hear you. But I will come back to you. In the meantime, we're going to be trying to fix our audio. Miss Panford, do we still have Miss Panford?
Yes.
All right, thank you for holding it down for us. Let's talk about performance. Okay, let's talk about performance.
Yeah.
Yeah, performance. Who is checking that a nurse is bringing her best performance to the workplace? Who is checking that the nurse is able to meet her many milestones, her required milestones? Because if you are in an environment for 2, 3, 4 years, you need to come out of there on a higher level than when you got in there. So how do we ensure that the nurse is traveling and clicking the several milestones that she's supposed to click? We have had complaints. One second. We have had complaints about nurses who feel that they feel like they are disposable, that they are being treated with a different standard or yardstick, and compared to other nurses who they feel that are being treated as if they are to be preserved for the organization. So we have the preservables and the disposables. That is highly unfair. Can we talk a little bit about performance and how the management treats its workforce to preserve, to make people feel that they are appreciated and empowered to grow on the ladder of success?
So one thing that I've noticed has become a rise in the nursing industry is self-evaluations.
Yes.
Self-evaluations come on an annual basis where nursing management ask nurses to evaluate themselves. They ask them to evaluate if they feel they're doing the best, if they can do better, and what goals they have for them, whether professional or personal. I have seen nurses just wing it, and then I have seen nurses take the time to give in-depth information and critiques about themselves. Those nurses who wing it are the nurses that are not looking to better themselves. So I can't speak about them. I can't focus on them. I can only talk about the nurses that takes it seriously. Those self-evaluations, if you score an amount, what you evaluate yourself. The nurse manager then helps you set goals for yourself. When I did the self-evaluation, I know I wanted to be certified in radiology nursing, and my nurse manager was very supportive in helping me get certified. I actually wrote a paper on certified nurses in the nursing field, and one of the biggest reasons why nurses do not get certified in their field is because of lack of support.
Yes.
I really feel like as nurse managers, as a nurse leader, it's very, very important to encourage staff, especially when they are doing self-evaluation and they're being very honest and being critical about their evaluation, to definitely foster that relationship of trust, support, and care for our nurses.
All right, that's a very good point. But how would a nurse? You talked about some nurses who just wing it, just get by. If a nurse is not feeling welcome on the unit, remember the toxic environment we talked about?
Yeah.
They kind of keep to themselves, reluctant to participate, and can hardly learn anyway. A nurse gets like a very heavy workload, a very heavy patient ratio, and then she's criticized for not, finding time to better themselves or to do something about their performance. What would you say in that situation? I want to touch on patient ratio, preserving your workforce, making your nurses feel supported, wanted, and appreciated. If you keep giving a nurse 7 patients, 10 patients, that's not like very supportive, and this is not a nurse that will be in a position to be able to learn anything. Can you speak on that situation, please? Miss Hannat?
And so, yes.
Yes. Patient ratio, yes.
Sure. Okay, so for patient ratio, one thing that I am a strong fight for is understanding the nurse man.
Something is going on with our audio.
Can you hear me?
Yeah, we can hear you now.
Okay, yes. I was saying that it's very important for the charge nurse or the nurse manager or the nurse leader in that instance, assistant manager, to understand that there is an acuity, that there may be an acuity imbalance on the unit. And it's very important for them to set guidelines and set rules for nurses to not all have patients with a high acuity part of patient load for the day. I think that one thing that we tried to do, or at least we started to do, was for the charge nurse to understand, go through the list, see what the acuity is on the unit, and when they are making the patient assignments, they're not giving one nurse so many patients with the high acuity. Unfortunately, the staff to nurse ratio, it can be skewed at some points because of the volume on the unit, because it might be low staffing. In that instance, I would try to get floaters from other units. I have the charge nurse take on a patient load as well, something to help the nurses alleviate that amount of strain that it can have when you're having 6 patients to one nurse and everybody is post-op day 1, and it can be very stressful. So in the past, I have seen it where charge nurses take on a few patients. I have seen it where we would get a float to help alleviate the patient to nurse ratio on the unit as well.
All right. Thank you so very much. Sometimes I hear in Nigeria a nurse could have like 15 patients to one nurse. I do not understand what the scope of practice is in Nigeria, but giving a nurse 15 patients, I think, is very counterproductive. That is not.
I agree.
That is not ideal performance or ideal practice. Okay.
I agree. And and I have seen it where if it were to ever get to a point where a nurse was not comfortable with the amount of patients she got, which would have to be an absurd number, they can refuse that patient caseload. Take not a day, but get a vacation day, and pretty much, because once you accept that, you're responsible for it. You have to take accountability. But if in the beginning you say, "But I'm not comfortable with this," if you have a union, you can get them involved.
I was coming to that.
Okay.
I was coming to that. Now, the very quiet nurse, the silent nurse, the nurse that keeps to herself, the nurse who is apparently getting bullied, would have resources she could fall back on to help her or to help ease her practice on the unit. Now, I got a lot of feedback from nurses, and I don't know why they are not jumping on this program and airing their views, but I would like us to explore the union, for example, and what other instances or what other methods or avenues are available to the nurse who is bullied, who is catching the highest patient ratio unfairly, who is feeling very uncomfortable in practice? What avenues are available to that nurse to help herself? Let's talk about the unions and the management. Thank you.
I am a very big advocate for reading the handbook. Either the contract, if you're in the union.
Reading the handbook.
Oh, yes. You have to read the handbook if you're unionized. Handbook. Most
audio.
So they look for vacation time. No, you have to look through it. And I cannot trust that enough, because if your manager is doing something that is not responsible, or that you're not responsible for, then you have that employee handbook or the union contract to cite and put up a fight. I'm a strong advocate for talking for yourself, because not everybody is going to do it for you. If you don't have a manager that will fight for you, only you can fight for yourself. So I am very, very big on reading the contract if you have the union, and reading the employee handbook. If there are some gray areas, ask HR.
Okay.
Ask HR. Yes.
Yes. Now, being quiet and hoping it will pass will not make anything better, like you just said. So the nurse that is bullied would, approach the union and make her complaints known. The nurse who does not feel supported by the manager, if there's no union, could talk to HR and have that situation sorted out. But let me ask you another question. The nurse that is vocal, saying, I cannot take this many people, I cannot handle this, would she not be labeled a troublemaker and gently eased out of that organization?
So, would she be labeled a troublemaker? The thing is, no, I would never label somebody. I would label them as somebody who does not take crap. and this is very actually to have important.
Something's going on with her audio.
Hear me?
Yes, now we can hear you.
I would not label her a troublemaker. I would label her as somebody who knows pushed around anyway. And that's somebody who is very smart.
Okay.
They're very smart, because, yes, the squeaky wheel gets the oil, but you also have to protect yourself. God forbid something happens, they give you a patient care caseload that is way beyond what you can really handle, and you don't speak up, and there's a medication error, they're going to point the finger at you. They're going to point the finger at you and say, you should have done this or you should have done that. Not, oh, you shouldn't have had that many. Of course not, no. You have to speak up for yourself. I cannot stress it enough. The one who does not speak up, I feel like it's very important for the nurse leader to create that kind of relationship with, even if they don't come to you soon enough, eventually being able to come to you so that you know that there are problems that need to be fixed. I think it's very important.
All right. This is very, I support that. I agree with that totally. All right. But let me ask you a question. Some of us who are immigrant nurses, were raised in another culture. And this culture encourages silence, right? Self-deprecation, like you prove your ability quietly, right? Some of us are not able to come out and just speak up, right? How do you temper culture? How do you temper where cultures clash? In this environment, you have to market yourself. You have to speak up, like I see my children do. But I was brought up in a culture where you silently, prove yourself. It's required, or it will help us, immigrant nurses, if we're able to determine that fine line and walk it well. What suggestions do you have for those people who come from a culture of quietness and self-deprecation, who find themselves practicing in this environment where you have to be on top of your game and tooting your own horn as you go?
So I think when it comes to one of the jobs that I've had in the past, they gave us a nursing portfolio.
Yes.
And in that portfolio, you can put, any exemplar, pretty much anything that you have achieved as a nurse. I think for those nurses where it might be a cultural difference, where, you're more meek, you're more docile, you're more, let me get my work done, I feel like you can also excel in that as well. So if you're not looking for a best friend at work, you're not looking to be part of the clique, you're looking to go in there, be the best nurse you can for 8 to 12 hours and go home. I feel like those nurses should get involved in like the nursing councils. There are different ones. There's evidence-based. There's nursing recruit and retention. There's so many different nursing councils now that a lot of hospitals want to become magnet. So you have opportunities to work behind the scenes as well.
Yes.
And that can also bring you out of your shell as well. But being part of different nursing councils will allow you to put that in your portfolio. A lot of hospitals are also doing like clinical ladders. So, again, you're not looking for a best friend on the unit. You're looking to go in and be the best nurse you can for 12 hours. So one thing that I have pride myself was getting a lot of patient satisfaction surveys with my name in it.
Oh, yes. That feels
like,
good.
I'm the bomb.com,
Yes, that feels good. Audio, check audio. What's going on? Can you hear us?
Yes, I can hear you. Can you hear me?
Oh, yes, we can hear you now. Yes.
Okay, yes. I was saying that, having these patients see your hard work and remember your name and actually take out the time to fill out the survey and say your name really goes to show what kind of nurse you are. So I feel like those nurses who, are not looking to speak up and they're just looking to go be the best 12 hours, do the best they can for those 12 hours, they should get involved in nursing practice councils. There's so many different ones in each hospital. Do the best you can with the patients that are bringing their name with patient satisfaction surveys. Putting all of that information in a portfolio. Most of the time, the nursing councils, they have projects, so to go back to and help some friend that they have discussed. You can put that in your portfolio as well.
Yes.
About yourself.
Yes. So.
Your portfolio.
Yes, great. So if you're one of the quiet nurses, try to join a nursing council so that you would have it on your portfolio, that you have this experience and you bring your own say to help socialization of the quiet nurses on the unit. The quiet nurse also would benefit from the patients being very satisfied with her performance and speaking out her name on many different assessment evaluations that get sent out to patients. Thank you so very much, Ms. Panford. Now let's talk about turnover. Cameraman, please, can you? Something is going on with the audio and the patient and the viewers are saying that they can't really hear us. Okay. Can we talk about turnover? How long should a nurse be in a particular organization before they switch, so that it would not look like you're job hopping from organization to organization? How long do you think is an average, an ideal time for a nurse to spend in an organization?
One thing that is great about being a nurse is that, well, at least if you're working 12 hours, is that you're really only working 3 days a week, 2 to 3 days a week, or 3 to 4, I should say, if you have to work the weekends. So you can definitely have more than one issue when they...
I cannot hear her. Ms. Panford, we cannot hear you. Something is going on with the audio. Something is going on with your audio, Ms. Panford.
Can you hear me now?
Yes.
Picking up?
Okay. That's better.
Can you hear me now?
Yes, that's
okay.
better. Mm-hmm.
Okay. Yes, I was saying that working as a nurse, more likely you're working 12-hour shifts, so you can have one job here, 2 jobs there. So having many jobs on your resume usually isn't that bad if they know that you're working, simultaneously with 2 different places. But as far as the longevity at a location, I feel like 3 to 5 years is best. 3 to 5 years is great because that is the amount of time that you need statistically to excel or to be an expert something. 3 to 5 years. If you're somebody who learns slowly or takes more time to adapt, I would say 5 years. If you learn quickly, I would say 3 years.
Okay, but you must go from when you're changing organizations, you must climb up the ladder, right?
Yes.
Yeah, because there has to be a change in your professional progress that shows that you entered as a staff nurse and then you left as a manager or a senior staff nurse. That will reflect nicely on your resume.
And I mean, it will reflect nicely on your resume, but also, again, what these hospitals are doing, in an effort to be recognized as a magnet hospital, is they're creating nurse career development. So even if you don't leave as a nurse manager, but you leave from being a nurse level 1 to a nurse level 4, there are certain criteria that you need to meet to get to each level. Yes. So if if on your resume you come in as a novice nurse and then you leave as an expert nurse, but not necessarily a nurse manager, they'll see that you were able to achieve goals while you were in your position.
All right. Okay. It's been a very interesting discussion. Thank you for taking out the time to speak with us. I was expecting the nurse from Nigeria and the nurse from England. Unfortunately, they could not connect. So I thank you for taking all that time to spend with us. In closing, are there any words of advice that you would say to the nurses watching now to use or to help themselves with in terms of having an easier passage on the hospital unit?
Well, easier passage is kind of a relative term because I don't know what somebody can handle, somebody else probably can't.
True.
What I will say is never limit yourself. Never, ever, ever limit yourself in whatever position that you're in as a nurse, whether you're staff, whether you're in nurse leadership, even as a student nurse. Never limit yourself. Always give yourself an opportunity to learn more. You can never stop learning as a nurse.
Yes.
Always give yourself an opportunity to learn something new. And get certified.
Get certified, yes. While on the unit, get certified. Learn everything you can. Join the nursing council or any other groups that are available at your workplace. Also, create relationships with the other nurses that are out of work relationships. Try to understand each other so you would kind of be tolerant of each other on the unit and out of the unit. When you understand what's going on with each other, I think it will make for an easier work relationship, right?
Yes.
All right. So at this point, permit me to wish you all the luck in the world in your new position as a nurse manager. And I thank all the nurses for watching and contributing. Thank you for your contributions from South Africa, from England, from Abuja, Nigeria, from all over. Thank you very much.
Thank you very much, Regina.
Thank you for hanging out with us. And I look forward to talking with you all next week, once again on your Saturday online program. It's been a pleasure. Thank you and God bless.